My name is Rachel Starr, and I'm an endocrinologist here at HSS. So endocrinology is a field of internal medicine that focuses on hormones, and hormones are messengers that travel through our body and tell organs what to produce in terms of chemicals that then regulate function of different parts of the body. Some common diseases that affect the endocrine system are things like hypo or hyperthyroidism, so too little or too much thyroid hormone, issues with female reproductive hormones that lead some women to not get their period or women to lose their period early. Also bone issues, which we often don't think about as related to endocrinology, but a lot of hormonal factors affect people's skeleton and might predispose someone to break their bones. Something I think a little bit unique about my endocrine practice is that I have a focus on women's health. I'm a menopause practitioner through the North American Menopause Society, and I help patients through the menopause transition. And I also help women in earlier reproductive years if they have menstrual irregularities to try to make sure that their periods are regulated, because we know that's very important for the skeletal health, for cardiovascular health, for overall well-being, for people trying to achieve fertility. When patients come to see me for an appointment, they can expect to have my undivided attention. I like to focus more on the individual than on the disease or on generalizations about what someone might be experiencing. So I definitely want to hear everyone's story firsthand. And I also like to work in a partnership with my patients so that we set out to define their healthcare goals and we work together to meet those goals as our relationship unfolds. Endocrinology ties very well into orthopedic surgery because a lot of the patients who are having orthopedic surgery on their bones have underlying metabolic bone issues, or there are ways we can optimize their skeletal health to improve the outcome of their surgery. When I see success in my patients, I feel like it's what keeps me going as a physician. When I see someone have that aha moment, or I see someone who came to see me, very sick with either very low bone density or poorly controlled diabetes, and then we work together and over a few months, a few years, their bone density increases, they're not fracturing,